Psychedelics, illegal party drugs or breakthrough medications. It's complicated and controversial, but lately there have been some undeniable evidence that makes us rethink the old mindset that they're all bad.
Game changer.
A form of hope.
One of them received an FDA green light a few years ago for medical use, and a couple others are showing a lot of promise in studies on resistant depression and post-traumatic stress disorder, giving a lot of people like combat war veterans some much needed hope. Let's dive in. Hi everyone, I'm Dr. Dan Monti from the Marcus Institute at Thomas Jefferson University. Welcome to House Call. In this episode, we're exploring psychedelic therapies for mental health. Treatments that were once taboo, but are now backed by serious science. We'll focus on 3 psychedelics that have recently gotten some impressive clinical data behind them, including one that now has FDA approval. And I'll walk you through a real patient in treatment. To set the stage why this is important, resistant depression and post-traumatic stress disorder, or PTSD, have low response rates to traditional therapies. Together, these 2 problems affect more than 20 million Americans. My colleague at the Marcus Institute and best-selling author, Dr. Sheryl, and I had a conversation about the urgency of this problem.
I've done a lot of talk therapy over the course of my life. I probably have spent 20 years in different individual psychotherapy. And I was shocked to learn that only about 1/3 of people with trauma who go through talk therapy resolve their symptoms. 1/3. That's pretty appalling. It's quite expensive. It takes a long time. And we've got to do better for our patients with trauma.
So clearly, we need new tools because, like traditional psychotherapies, the traditional drugs for depression and PTSD also have very disappointing results.
More than 16 million adults have experienced a major depressive episode in the past year, but only 30% respond by going to therapy or taking medicine.
This is where psychedelics come in, not as party drugs, but as carefully guided therapies in medical settings. By medical psychedelics, I'm referring to 3 substances: Psilocybin from magic mushrooms, MDMA, aka Molly or ecstasy, and ketamine. These drugs can temporarily alter mood and perception, but in the right setting, studies are showing that the effect can be healing for people who hit a wall with other therapies. Here's why that matters. Depression and PTSD often trap people in rigid thought loops. Psychedelics seem to reset the brain, like shaking a snow globe or rebooting a frozen computer. Scientists believe they boost neuroplasticity, helping the brain rewire and heal in ways traditional meds can't. But this isn't about popping a pill and moving on. Psychedelic therapy happens under medical supervision, and ideally with trained therapists. The goal isn't escape, it's transformation. Now let's get into the treatments already changing lives and what every patient should know. Ketamine is the first and so far only FDA-approved psychedelic, and it has seen some promising research for depression. The approved nasal spray is called Esketamine or Spravato.
The self-pay, low-dose hallucinogenic that is helping some people cope with depression and anxiety.
For adults with major depressive disorder, or MDD, who haven't seen enough improvement after trying at least 2 different oral antidepressants, regular antidepressants just don't work well enough here, and that's where Spravato comes in.
This therapy aims to kickstart a powerful chain reaction that helps mood circuits reconnect and reset. It enhances neuroplasticity, meaning your brain becomes more flexible, more capable of healing. And the results can happen fast, especially compared to standard therapies. I interviewed a woman receiving Spravato therapy. This lovely lady, Sheryl, looked perfectly fine on the outside, like many people who have a war going on the inside.
I used to be very lively, and I was like a bartender, and I did lots of different things, and then somewhere along the line that kind of just disappeared. But if you ask anybody, they're like, oh, she's so nice, she's great, she's such a good friend, oh, she's a great coworker,
right,
she's such a good mom.
But it's sometimes high performers really suffer in silence.
Because
they know how to make the rest of the world seem like everything's okay. And that's where things hit a wall. After years of trying every option, Sheryl was exhausted. She wasn't just sad, she was barely getting through the day.
Nothing was helping, so I gave up for a long time.
And just sort of found a way to get through life with this internal struggle.
Always. Honestly, it was really, really hard to even get out of bed. Struggled just to get out of bed and get in the shower and get on with the day.
And just when she was about to give up for good, she found something that changed everything. Spravato. But this isn't something you take at home.
Come on in.
Thank you.
And then I'm gonna just grab Dr. Young. We'll get your blood pressure and then he'll begin to start you.
Super great.
Spravato is given in a clinic with a trained professional by your side. You spray it in your nose.
All right.
You haven't done this for a while, huh?
Yeah.
Yeah.
That you drink. Like the first one, you never really feel much of anything. But after the second one, it started to feel a little, it doesn't burn or anything. It's just, this doesn't taste so good. Yeah, it's a little unpleasant. But I think having things ready, the drinks and the ginger definitely helps.
Okay. So normally you are going to relax and just close eyes. We'll turn off the lights.
Okay.
Then sit back for about 2 hours while being monitored for side effects like dizziness or feeling a bit disconnected or dissociated.
Any dissociated?
I did, yeah. Like I couldn't really move. If I opened my eyes, I saw like my hands, but I couldn't figure out like how to move them. So then I just keep my eyes closed. And usually all I see is colors.
Yeah.
Different kind of pixels and colors.
How do you feel?
I feel, I was thinking about this. What was I gonna say? I feel mentally, I feel very light right now. Physically a little tingly. But it's not always like an immediate effect, but it's like I don't have a pit in my stomach anymore. Like I feel a little bit like I can breathe, So I think that's what makes it good to just continue. It's like the after effects will just continue to come over the next weeks, days and weeks.
So Sheryl, we're a few minutes after your treatment. So let me ask you this.
Yeah.
If you were to right now rate your mood on a scale of 0 to 10, with 0 being the worst state possible and 10 being as good as you could imagine, where would you put it right now?
I'd say like a 9.
Yeah.
I don't know what a 10 would be.
Right.
I think
Well, 9 sounds pretty good.
9 sounds pretty good. Like I could probably walk out of here and I don't dance or anything, but I could see like being around my kids and like joking around and like doing like a funny dance to some song that we love, like I
love that.
I could feel I can do that. Like I have the energy, the motion to just do it. Nothing's holding me back. Because before I would always have this vision of what I wanted to be.
Yeah.
And I just couldn't get there, There's no sound for this, right?
We won't really hear it like...
Yeah, so we can say, what do you want for dinner?
I mean, I've noticed that she's like a lot happier and like way more positive and like not as strained. Don't cry. If you cry, I'm going to cry, and then Tucker's gonna have to comfort us both.
And here's the exciting part. Sheryl's not some rare exception. In clinical trials, nearly half of patients went into remission after just a few weeks of Spravato. Some felt better almost immediately. What I love about Sheryl's story is the positive effect Sheryl getting better had on her family. Now let's talk about MDMA. Yep, the street drug commonly known as ecstasy. Turns out, under the right conditions, it might be one of the most powerful tools we've ever seen for PTSD. In clinical trials that really showed an impact, medical administration of MDMA was paired with psychotherapy, which is historically how it was used in the 1970s before it was banned. Shockingly, in recent clinical trials, over 70% of patients no longer met the criteria for PTSD after just 3 MDMA-assisted therapy sessions. That's huge. How does it work? MDMA floods the brain with serotonin and oxytocin, chemicals that reduce fear and boost connection, so patients can better face their trauma without the natural survival fear response shutting down the process. And it's not just about reliving pain. It's about reprocessing it with support in a way that finally allows the person to let it go. That's why the FDA gave this treatment breakthrough therapy status. It's not approved yet, but hopefully the FDA will reconsider it soon. Fortunately, there are some powerful political pushes, especially to make it available for veterans. Last but not least on the list, Psilocybin, the compound in magic mushrooms. But this isn't about tripping in the woods. In therapy, it's changing lives. In one head-to-head trial, people taking psilocybin were twice as likely to reach remission from their depression as those on antidepressants. Another study, nearly 3 out of 4 stayed in remission 4 months later. The process? Just 1 or 2 guided sessions, no daily meds, with trained therapists by your side. People often describe it as 10 years of therapy in 1 day. It's not mainstream yet, but it's close. Oregon and Colorado have legalized it under supervision, and the FDA has already given it breakthrough status. To wrap up, the word psychedelic comes from Greek roots meaning mind manifesting. For years, these substances were used recreationally and completely banned out of fear that any good would be outweighed by the bad. And in the wrong settings, that fear wasn't unfounded. But today, we're not talking about recreational use or party drugs. We're talking about medical-grade compounds delivered with clinical oversight in carefully controlled environments. Used responsibly, they're helping unravel illnesses that once seemed untreatable and helping people reclaim their lives. As a doctor, that's profoundly hopeful. But like all powerful tools in medicine, we must use them with both open minds and rigorous standards. Thanks so much for watching. If you found this helpful or know someone who might benefit from hearing about these cutting-edge treatments, please share this video. And with that, this is House Call. I'm Dr. Dan Monti. Until next time, be well.